moment I stepped in, Delta wave started.
I must say that truly we underestimate the virus.
Daily we have nurses and staff coming to us in tears to share how tired they are because of the workload.
The Health Ministry says COVID-19 isolation beds are 85% full.
Those 3 months were probably the hardest.
The fatigue was very real. The virus is also very real.
We needed to work very hard to assure healthcare workers that we had their back. We are asking them to work long hours for extended periods, consecutive days, having to isolate themselves, wear their protective equipment, gown out, gown down on a daily basis. And this was experienced by all healthcare workers.
For the physicians, we were pulling all kinds of odd shifts and coming back in the middle of the night to look at the patients and things like that. And this was across all ranks, from the junior doctors to the registrars to the consultants.
There was a patient in ICU. It was so difficult to get enough oxygen into her, even so difficult to get carbon dioxide out of her, that we felt helpless. That was a feeling of helpless that I'll never ever forget.
The nurses have it the worst because they spend hours in the room with the patient, just doing simple things like changing or looking after the tubes and lines and things like that. They come out drenched and they were exhausted.
In 1 week, we lost 3 patients. When their children come up to the wards, they cannot go into the room. They actually wanted to go in to hold their loved one when they are passed on, but they can't do that. So it's very heartbroken when actually you can see them kneel outside the door, cry very badly. Our nurses see on this.
Our nurses were getting quite exhausted. Some of them couldn't take leave. And for those foreign staff that still couldn't go home to visit their family, that was really tough.
In my ward, we do have quite a few foreign nurses, whether it's from Philippines, whether it's from Myanmar, from Malaysia. They are still not able to go back. Some of them shared with me that their family over in their country also contacted with COVID, and they are very, very sick.
And in Myanmar, it's not like Singapore. The medical equipment not enough. Even the oxygen tanks are not enough. Hospital doesn't even accept COVID patients.
Personally, I had immense guilt for not being able to look after my own parents back home. They were so near yet so far. I was looking after someone else and tending to someone else's family, but I was kind of neglecting my own family back home. I couldn't go back for about 2 years.
One of my doctor's father passed away in Penang. She was obviously very distraught and she wanted to go back. But she knew that because of the shortage of staff, it would be very irresponsible for her to just run back to Penang. But when the rest of the doctors found out, they actually told her, just drop it, just leave, and we will cover for you.
One nurse came to me, crying to me. She shared with me the landlord wanted them to move to another place as soon as possible. So I said, is the contract due? She told me no. Then why did the landlord ask you all to move? Oh, because I was contacted with COVID.
My colleagues told me that when she go home, all her luggage just outside the door. It's around 12 midnight. She quickly phone called my nursing officer. My nursing officer is very shocked also, but then she act very fast. She actually let my colleagues stay in the house like a few weeks before new accommodation can be found.
Our colleagues were affected by COVID as well. So one by one, they fell sick, down by COVID. So the manpower was really stretched.
Even though they were not seriously ill, they would be on MC for 7 days at least. And that put a strain on the people left behind.
At that time, the staff are very, very low morale. Every day is fatigue, plus. No words can describe the fatigue furthermore.
You feel mentally fatigued, emotionally fatigued, physically fatigued. Sometimes you don't even get to drink water, or sometimes even go to the toilet and even skip your meals.
Feeding us well is a common theme as far as keeping morale up is concerned. We received lots of sponsorship of food. There was bubble tea, there was ice cream.
Our senior leaders was pushing in those kind of trolleys with potong ice cream. They were like, yay, potong, yay, drinks, that kind of thing.
There were other innovative ways they tried to keep our spirits up, such as, I remember once all of us were given a neck massager. Do you remember? Yeah.
The support from public was also very crucial in ensuring that we continued to work with the spirit that we were working with. I think there would be like messages coming in daily, either in the form of cards or bouquets.
We also received like postcards from those primary and secondary school students with their inspiring artwork saying that, oh, thank you to healthcare heroes. And that's really very touched and very nice.
We did whatever we could to support our healthcare workers, and show that we are behind them. But this is something we had to go through. But I hope our healthcare workers understood that.
Well, one thing about epidemics is it's a roller coaster. In early December, we heard the news of this new variant of concern in South Africa called Omicron.
We were extremely worried as part of the healthcare community when the Omicron variant emerged because it appeared to be a lot more able to transmit.
The whole thing was studded with mutations. It looked like a Christmas tree. So we were very worried because it wasn't just 1 or 2 mutations, it was 30 over mutations on the spike protein.
They have enhanced mechanisms to invade the upper respiratory system, plus the fact that they're able to escape from the previous immunity. Therefore, it gives it a lot of advantages to multiply and to infect many people.
Those cases who were not vaccinated had much more severe outcomes, including higher number of deaths, compared to individuals who were vaccinated. Now, obviously, vaccination changed things. And once you add boosters to that mix, and you also add natural infection, it adds to what we call hybrid immunity.
So this hybrid immune protection that they have has also allowed us to benefit from having a situation where most people have mild infections. This has further reduced our demand on our hospital beds.
We could actually stop dancing to the tune of the virus, and we danced to our own tune where we moved forward and forward and forward.
So once we have enough data, you start to realize with vaccine, full dose, the probability of dying after infection with COVID-19 is half that of influenza. Without vaccination, it's 5 times that of influenza. And we've been living with influenza.
We need to update our mindsets. We should respect COVID-19, but we must not be paralyzed by fear.
And so in September and October and beyond, we were starting to move towards living with COVID.
Now we are transiting to a situation where individuals make their own assessment of their own risks, of their own particular situation. And the tools are there really for them. Masks, tests. Individuals can decide on the level of precautions they want to take for themselves and their families.
Sometime in the middle of 2020, at the MTF press conference, Minister Gan and I, in fact, had tested waters because we already were thinking ahead of whether we needed to present a home recovery option, but there was pushback from the ground.
Our healthcare system had always been heavily dependent on hospitals. You really want to make sure that the patient is well sited to the appropriate place, whereby he or she can be safely monitored without him choking up resource that can be used for other patients who need it most. So home recovery program was an effort that we brought in when we realized that many of our patients would remain well, especially when we move on to the Omicron phase.
We have been reviewing the overseas literature, the protocols, speaking to our counterparts, let's say in the UK, and understand how they have been rolling out home recovery program, and we wanted to launch it by end August.
We were in a pilot phase when Delta broke out, so we were not quite ready.
On hindsight, it's always easy to say, that we could have handled it much better. It was actually a small pilot. But for the past 1.5 years, where they know that if they have COVID, they either have to go to the hospital or go to an isolation facility to be cared for with medical support and nursing support on site. Suddenly, you're telling these people, you are safe, you can stay at home to recover. I think there was this mindset shift.
Oh, it's so complex that I don't even remember. It was trying to accomplish zero COVID. It was designed for zero COVID.
The healthcare protocols before P123 were very, very complicated. Partly because the disease course depends quite a lot on whether the person is vaccinated, how old the person is, and also a bunch of other risk factors, including, for example, whether they have chronic illness, even their body weight. While it's okay for medical personnel to deal with this complexity, it's not possible to advise the public in those terms.
People telling you your rules are more scary than the virus, that was an awakening moment. And some comments were particularly enlightening, where they say that it's just so complicated, I don't understand. When I don't understand, I don't know how to do my part. If you simplify it, I know how to do my part and I can help others do their part. So I'm comforted by all this, and that gave us the decisiveness that encouraged us to be more decisive in making the changes. After 2 over years, today is really a happy day and marks a very important milestone, a reduction of our pandemic status from orange to yellow.
It was almost symbolic. I recall we had a town hall the following day. The senior management all wore yellow.
Most people forget that our primary care practitioners, GPs, who may be working in single GP clinics, they're playing an important part of the entire fight against COVID. They are at the forefront, literally the tip of the spear for us.
When someone falls ill, if they were to come back with a bit of a cough or fever, the first place that they would head to would be their primary care doctor.
The primary care network is essentially a network of independent small GP clinics coming together under a common umbrella where there is peer support and sharing of information. We had a large number of GPs who started doing the swab and send home services.
We had webinars where doctors who were actively doing the swabs videoed themselves, how they did it. They shared those videos, and I think it was very reassuring to other fellow doctors.
More and more GPs came on board to support the fight against the pandemic.
I found out I was pregnant at the beginning of the pandemic. It never crossed my mind to close shop.
You've requested for a consult because you're coughing the past.
I was involved with the home recovery program. For me, it was a matter of following up on them remotely, making sure that they remain all right a few days later, that they're not deteriorating or getting worse.
What we did was we gave out our phone numbers to these patients, and when these patients had any problems, for example, they needed to extend their medications, they would actually call us up and do consults via telehealth, and then we would actually send more medications to their house.
We were very gratified that the majority of GPs were willing to step up and take on this responsibility.
Where it matters, Singaporeans always can be counted on to do the right thing. The great majority were prepared to do their part. I think it has to do with social trust. Not just people trusting government, but also government trusting people and people trusting each other.
It's been a long time working with COVID, now nearly 3 years. I've seen many people make sacrifices, not complaining, quietly working on the ground.
Essentially everyone, really everybody making sacrifices to come together, go beyond their usual role.
We don't work in ministry silos, but when needed, we can come together and work as whole of government, which came true because I think if it's Ministry of Health alone, we could not have prevailed in this fight.
Usually in any crisis, the teams that come through a crisis would form very much tighter bonds. I would like to believe that the pandemic has done the same.
I'm quite proud of how, as a whole country, as a whole system, we actually put the different parts together.
Having both public healthcare and private healthcare coming together as a national healthcare system was really one of the key success factors.
Singapore will stand down all remaining COVID-19 measures from next Monday.
We will move from DORSCON yellow to green, and we will stand down the multi-ministry task force.
DORSCON green, it was symbolic, marking a final phase in our journey of managing COVID.
It is only a matter of time before disease X happens. So we had better learn from COVID-19 how to deal with a pandemic and be as ready as we can should a worse one, when a worse one befalls us.
Disease X might come in another form and we have to roll out different measures. And the most important is to stay prepared, but also be nimble.
We need to have better connections with our neighboring countries as well as in the world, because the exchange of the information is something that's going to be very useful in combating any of the new pathogens.
Science can really play such an important part in our ability to respond more quickly and more effectively to an unknown epidemic. And the corollary of that, of course, is how can we strengthen our science capabilities so that we can do an even better job in future pandemics.
There's also a need for system-level resilience. You go to a hospital today, they're working extremely hard because they have about 85% occupancy rate. When it comes to a surge, such as COVID or any other disease, that buffer would be very quickly eroded. So we'd have to think of new ways to create additional capabilities.
People talk about data is the new oil to be tapped and things like that. Using data, citing the care out in the community enabled by such digital technologies will be a very important tools that we can use to address some of these challenges that we will face in the coming years.
We need to invest in the use of data and data analytics to make sure that we have sufficient data from our entire supply chain, and to be able to use this data to help us to do stocking and to foresee what is the next crisis.
We have to be prepared for wherever you may not be familiar with and not just rely on what you know from the past.
We can't fight the next war like how we fought the last one. COVID-19, I think, proved that to us.
The chapter on COVID-19 is a thick one. In the next chapter, our hospitals and healthcare systems will be better, our laws more complete, our vaccines and medical supplies more secure. We will set up a new communicable disease agency. It will oversee disease preparedness and outbreak response. The Infectious Diseases Act must be amended to be more future-proof. We will invest in vaccine research and development, and we will be anchoring 6 vaccine manufacturing plants in Singapore. We have a duty to learn from the crisis and ensure that those whose lives were lost to COVID-19 did not pass in vain, and it will not be in vain. We have a bigger pandemic coming, which is aging and all the chronic illnesses that it will bring, and that is inevitable. It is coming.
With more chronic diseases, we actually need a lot more of our interventions to go out to the community. We need much more integration between health system, community services, social services.
MOH always knew preventive care and healthy living is best done with a strong, dedicated doctor-patient relationship. And so that is what we need to rebuild, but now rebuild back as a government program, a national program in Healthier SG.
Healthier SG will be then tapping on the PCNs again, that peer support. It has worked for COVID, and we think it will also work for healthcare management.
And there are many advantages of caring for them at home, allowing our healthcare system to be more varied, to be able to manage our patients better in the most appropriate place.
It's a good stepping stone to the whole healthcare transformation that we hope to be able to see.
We owe so much to our health professionals who have been just so exceptional in their commitment, in their professionalism, in staying the course. Selflessly just doing the things that need to be done. It's really quite amazing.
I think heroes walk among us. I had the opportunity to work with people from different sectors. Everyone was united in their purpose to actually help Singapore get over this pandemic.
I call them silent saints, right? Scattered throughout the healthcare system. People who will never be recognized for what they did. Could be a porter, the cleaner in the hospital system, administrator. These people who really just slaved away selflessly without any recognition for what they've done.
I want to thank them for their dedication, for their determination, for their resilience, and for putting themselves in harm's way to protect all of us. I'm very happy to be able to have a pleasure and honor to be working with very dedicated healthcare workers.
It is a testimony to our healthcare services that in the most difficult period, they stood at their positions, their posts, and they continue to do the work.
I often tell my colleagues that actually when you look at leaders in any organization, the leaders can only do so much. I have not seen in my entire career a more committed, more dedicated, and a more competent team. I want to say a big thank you.
It is the healthcare workers, healthcare professionals that provide us the care, the comfort, and the hope. They were not the front line, but they were the last line of defense. I know deep in their hearts, they know that they are in a noble profession.